Myself, T. Sivaranjane, Department of Social Work, Nalamutha Counter Mahalingam College, Pollachi. So now we going to see eating disorder. So what is an eating disorder? So eating disorder or mental illness that cause serious disturbances in a person everyday diet. So it can manifest as eating extremely small amount of food or severely overeating. The condition may begin as just eating too little or too much, but obsession with eating and food overtakes over the life of a person, leading to severe changes. So these are all some potential signs of eating disorder. So who do eating disorder affect? So everyone will affect eating disorder, people of all gender, race, etc. So a statistical say 20 million women and 10 million men will struggle with an eating disorder. So some truths about eating disorder. So many people with eating disorders look healthy yet may be extremely ill. Families are not to blame and can be the patients and provides best allies in treatment. An eating disorder diagnosis is healthy crisis that distributes personal and family functioning. Eating disorders are not choices but serious biologically influenced illness. So eating disorder carry an increased risk for both suicide and medical complications. Genes and environment play important role in the eating disorder. Genes alone do not predict who will develop eating disorders. Full recovery from an eating disorder is possible. Early detection and interventions are very important. So some types of eating disorder: anorexia nervosa, bulimia nervosa, binge eating disorder, and pica and avoidant disorder. So anorexia nervosa, so people will affect anorexia, obsessed with becoming thin, that they reach extreme measures and this leads to extreme weight loss. So anorexia nervosa, some warning signs: dramatic weight loss, refusal to eat certain foods and categories, consist excuse to avoid situations involving food, excessive and rigid exercise routine, and withdrawal from useful friends and relatives, for isolated from society. So they are thinking their food habits and they are eating what they eat, etc. So health risks with anorexia: heart failure, kidney failure, low protein storage, and digestive problems. So second one, bulimia nervosa. So people will affect bulimia nervosa, starts to consume large amount of food at once and then is followed by purging using laxatives or over exercising to rid themselves of the food they ate. They are continuously calculate food what we take. Bulimia nervosa warning signs: vapors, containers indicating consumption of large amount of food, frequent trips to bathroom after meals, signs of vomiting, for example staining of teeth, an excessive and rigid exercise routine, withdrawal from useful friends and relatives. Health risks of bulimia: dental problem, stomach rupture, menstruation problems, anxiety, depression, personality disorders or some bipolar disorders, misuse of alcohol or drugs, self-injury, suicidal thoughts or suicide. Binge eating disorder. So binge eating disorder, binge eating is a disorder in which someone eats lot of amount of food at a time but they don't vomit. So it some warning signs. So same, vapors, containers indicates consumption of large amount of food, maybe overweight of age and height. So this is called obesity. So nowadays obesity is a very big issue of recent generation. may have a long history of repeated effort to diet, feel desperate about their difficulty to control food intake, may eat throughout the day with no planned meal times. So some health risks of binge eating disorder: high blood pressure, high cholesterol, gallbladder disease, diabetes, heart disease, certain types of cancer. And fourth one, pica. Pica is an eating disorder that involves eating things that are not considered food and that do not provide nutritional values. So individual with pica crave non-food substance as ice, dirt, soil, detergents, and cloth, hair, wool, etc. So individuals with pica may be at an increased risk of poisoning, infections, gut injuries, and nutritional deficiencies. And avoidant restrictive food intake disorder. So individuals with this disorder experience disrupted eating due to either a lack of interest in eating or distaste for certain smell, taste, color, texture, or temperatures. So common symptoms: avoidance or restriction of food intake that prevents that person from eating enough calories or nutrients. So eating habits that interface with the typical social functions such as eating with others. Weight loss or poor development for age, height, and nutrition deficiency or dependence on supplements or tube feeding. So why do people develop eating disorder? So some behaviors or unhealthy coping mechanism, or some factors will say why people will develop eating disorder. So psychological factor, interpersonal factor, socio-cultural factor, and last one, biological factor. So psychological factors: low self-esteem, feeling was inadequacy or failure, feeling out of control, response to change like puberty, response to stress with the compulsion of sports, dance, etc. Some personal illness. So interpersonal factors: troubled family and personal relationship, difficulty expressing emotions and feelings, history of being teased or ridiculed based on size or weight, history of physical or sexual abuse. Social and cultural factors: some cultural says, so cultural pressures that glorify thinness and place value on obtaining the perfect body, narrow definition of beauty that include only women and men of specific body weights and shapes. Cultural norms that value people on the basic of physical appearance and not inner qualities and strengths. Biological factors: so eating disorders of run in families and genetic components. So research say, so brain and eating isn't taking place of our eating habits. Thank you.